Hello. So I wanted to share with everybody about an article that I opened up this morning. And again, it was talking about CPAP use and evaluating how many patients actually utilized their CPAP after it was discovered that they had sleep apnea. And again, this study, as long as a lot of the other studies that have come out previously, have elucidated or highlighted for us that CPAP wear is not happening. People are not being compliant with CPAP wear. And in this patient population in particular, they showed that less than half of the population of the patients in this study were using their CPAP. Most of them either didn't get the CPAP because they couldn't see the benefit of it or stopped using it within a year. And this is really no different than what we see in our clinic as well. And I love CPAP if you're going to use it, right? I love anything that's going to help treat your sleep breathing disorder. But the problem is most people don't continue to wear their CPAP. They find it uncomfortable. They find the mask fit not well. Some people just don't want to go through it. And again, some people aren't really understanding what the benefit of it is. And so that's where my clinic comes in and we offer alternatives to CPAP. So we offer oral appliances. And I really just, again, want to highlight there's nothing against CPAP. CPAP is the gold standard. If you're going to wear your CPAP, that's great. Then I want you to wear your CPAP. We certainly have patients that come in and, we send them off for the sleep study and they're like, that wasn't so bad. And I say, that's great. Then that's what you should do. Whatever you are going to comply with is the treatment that you should follow through on. But if your CPAP machine is going to sit in your closet and you're not going to comply with treatment, meaning you're not going to wear it, we need to find something that's going to help us treat your sleep apnea because this is a very serious issue. It's a very serious disorder that needs to be taken very seriously. There are severe long-term health consequences that come from untreated sleep apnea. So we know cardiovascular disease or heart disease is a big one. Those are so intricately tied, but we also know things about cognitive issues. So emotional instability, depression, anxiety, Alzheimer's, there's links to Parkinson's disease. And these things, quite frankly, seem to be the things that frighten my patients more than anything. For some reason, heart disease doesn't really scare people anymore. But when I say, there's a link between, cognitive issues, depression, anxiety, Alzheimer's, especially, and untreated sleep breathing disorders, that sort of tends to get people's attention a little bit more. So if you have sleep apnea or even think you have an issue, difficulty breathing at nighttime, or you have some sort of sleep breathing disorder, I urge you, come see us, talk to your primary care physician, just get it treated. Don't leave it alone any longer. Don't ignore it and act like it's not something that needs to be properly treated. If you have questions, you can always reach out to us on our email, info@clevelandtmjsleep.com. You can DM me here on Instagram or just leave comments on any one of our posts if it speaks to you.